I'm doing double duty. Helping with the team here. Yeah. Okay, great. So thank you so much. Hello, everyone. I am quite sorry. I already have teacher voice. It's called over here. I am just so pleased to see you all here today. The entire time that I have been working at Healthcare Now, I've been doing so remotely. So I literally haven't met a single one of you in person. And I am so excited to see all the faces that I see on YouTube, and all the different state trainings in the past. How many of you have been to an event before? Or not? Most of you it's just to let you guys know about some logistics. A lot of folks wanted to be here. They could afford it. They need to protect themselves from news, right? My time is up.
For all, and we are so grateful to have Stephan, Ramdohr, Chair, Medicare for all Florida.
Thank you, everyone. Morning. Yes, this is so great to see everyone here. So, my name is Stephan, and I'm currently serving as the chair of Medicare for all Florida. And so everybody kind of helps makes this happen. Gillian with Healthcare Now, I'm grateful to all of the organizations who co-sponsored this event and yeah, to everybody who attends here today. And yeah, for myself, the reason that I'm in this work is just yeah, not only for my wife and I, but everyone would love to see.
Yeah.
I feel like I have a perspective to bring this because my accent gives it away. Originally, I'm from Germany, so
Yes.
actually I'm able to see in my own lived experience how at one point of time I was able to be in a place where there was universal healthcare reality and there's really peace of mind. And so I feel like there's no reason that here in the United States now can't have something similar. So that's really just what keeps me fighting. And yeah, I'm so happy that today and tomorrow that all of us we're gonna have healthcare stories and learn about the incredible healthcare. So actually we have later this them being the showing up for Medicare for all in the resistance, which is being put on by public citizens. And united with using patients out of politics. We also see this union song for universal health solidarity in the universal healthcare movement. Then we have local passing municipal resolutions for Medicare for all. So as some of you might know, there's already hundreds of cities and counties that did pass resolutions for Medicare for all, even in Florida. We're going to have opportunities in other states because we have people actually from our country who are here today. So there's a workshop called Healthcare for All, One State at a Time, put on by our amazing allies with one payer states. So they're going to be strategies from the fight for state-based single payer because there are states in the country that already are actually very close to getting universal health care passed and making it a reality soon. So we're going to be able to hear about that. We have bring the grassroots to the state house, organizing a lobby day for Medicare for all. Workshop put on by Students for a National Health Program.
Yeah.
And yes, last but not least, we also have our stories, telling your healthcare story in the fight for healthcare justice, which is presented by Florida Voices for Health. So I'm very much looking forward to that. And that's just the workshops this afternoon. And then tomorrow, not only we're going to have the opportunity to hear from great speakers, including Representative Escamani, but also tomorrow we're going to have sessions. So yes, I just really look forward to spending all of today and tomorrow with all of you. Thank you.
Without him, Medicare for All Florida is nothing. He does all the work behind the scenes. I also want you to know that I know some people don't like paper, but thank goodness Stephan printed this out for me. And so just let you know, this is the intro for Alex Taylor. And I'm not reading it to you because I love you. But all I do know is that she is so instrumental. If you know the Representative Darren Soto, it was her help that we were able to get him to co-sponsor the Medicare for All bill. The things that you helped us to do and has made it so wonderful, and we thank you. Thank goodness you joined 2019 with National Nurses United. So I'm just going to leave it up to you. All of these wonderful credentials. Wow, this podium is not for short people. Literally standing on my tippy toes. No, it's okay. It's okay. It's great. Hello, everyone. It's so good to be here with you today. My name is Alex Taylor. I'm a lead organizer on the Medicare for All campaign as United. Also known as So, yeah, I've been with NNU since 2019. I'm really, very lucky to work with a team of amazing organizers, on behalf of amazing nurses. And, you know, we are just big supporters of Gillian and Healthcare Now and, of Medicare for All Florida and of all the other amazing organizations here today. So if you aren't familiar with us, the NNU is the largest union of registered nurses in the country. We represent over 225 bedside nurses.
Yeah.
And the nurses in our union have been fighting for Medicare for all for decades, because they see firsthand how broken our healthcare system is. And it is really, truly my honor to get to work on that campaign, on behalf of the nurses every day. So I'm also just very excited to be here with you all today to continue the critical work of fighting for Medicare for all. I want to give a huge thank you to Gillian, and Healthcare Now. And of course, Medicare for All Florida.
Yeah.
For bringing us all together, at a time when the fight for Medicare for all, it really couldn't be more urgent. We are in a political moment that demands that we speak plainly about what working people are facing, what the healthcare system is doing to us, and what a real solution to our pain is. We understand that Medicare for all, that solution is Medicare all. And we are all here because we understand that the movement that delivers it will not come from benevolent politicians. It will come from workers. It will come from their unions. And it will come from the communities that suffer every day under for-profit healthcare. So everybody here in this room carries something extremely powerful, something that will be key to winning Medicare for all. You all carry the lived experience, with the complexity that is the American healthcare system. That lived experience is why nurses with our union have been fighting for Medicare for all for decades. Nurses support Medicare for all because they see the damage that the for-profit healthcare system inflicts on people. Nurses are on the front lines of our broken healthcare system and know that the only fix for care is based on need rather than insurance status.
Yes. Yeah.
Every nurse, and I know there's some in the room here today, every nurse who has had to hand a discharge sheet to a patient who wants to get better but has no way to pay for follow-up care knows exactly why reforming the system around profit margins will never work. Reform will not work. Incremental tweaks will not save lives. A single payer Medicare for all system will.
Yeah.
And let's not forget what Medicare for all would be for workers across the country. For union workers, healthcare, health insurance dominates contract negotiations. Employers use health benefits as striking workers. When, not if, but when we pass Medicare for all, the boss's leverage disappears. Employers lose one of their strongest tools for suppressing wages and dividing workers. Union workers, yes. Union workers can spend more time at the bargaining table focusing on wages, safety, staffing, scheduling, and dignity on the job. And for the entire working class, Medicare for all, of course, as we all know, would mean no more copays, deductibles, premiums, or out-of-pocket costs. No more choosing between groceries and your prescriptions. When we win, Medicare
Yeah.
for all will be the largest victory for the working class in nearly a century. But in order to win, it's going to take all of us coming together. We have to continue to bring in more unions, more organizations, and more everyday people until we build a movement large enough and powerful enough to win. These days, this kind of solidarity, it matters more than ever. The Trump administration is openly aligning with the for-profit healthcare industry. And its cuts against its agenda of Medicaid cuts, Medicare privatization, and the erosion of ACA subsidies only squeeze the working class more. If we retreat during give the corporate healthcare it wants, it wants us demoralized, silent, and divided. They want us fighting defensive battles. So Medicare for all looks like a distant dream instead of an urgent necessity. But here's the truth. Medicare for all is not a luxury policy from good political times. Medicare for all is a cycle policy for times exactly like these. The movements that transform society are not the ones that wait for permission from elected officials.
That's right.
Yes, that is right. They are the ones that build power until elected officials have no choice but to get in line.
Exactly.
And that is how every major labor and civil rights victory in this country was won. And it's how Medicare for all will be won as well.
Yeah.
So I want to end by thanking you all for being here and committing your time and your courage. When workers lead, we win. When we organize, we win. And when we refuse to accept a system that treats healthcare as a commodity, we win. Up to Medicare for all comes right through rooms like these. So let's get to work. Thank you so much, Alex.
So let's have some video greetings. We have the U.S. Representative Pamela Jayla Powell. Washington introduced the National Medicare for All bill in the act for the last session.
Oh, that's such a surprise. So sorry. Just give me a moment. Actually, why don't we move on to our first panel while I straighten out this technical difficulty? Sound good?
So you want to do the panel first?
Yes, absolutely. We're good, right? That's great.
All about flexible. That's the word, flexible. Okay, so that was.
Back to you, Candy.
Thanks for being much, Ronda. And now, as we had heard previously, we're going to have a panel of people. And I wasn't sure exactly, did you want them to have 4 chairs up here? And will it be coming from 4 chairs, Gillian?
We'll just come from here. We'll
Okay.
just come from our table, right?
Yeah, absolutely. That's great. Yeah.
They roll. I love that.
I love having everybody be.
Oh, okay.
See everybody.
All right.
And I asked Ronda if it would be possible for you to introduce this first panel. You will see throughout this morning, as you've already seen in the 3 welcomes that you've had, that we have people who are just loaded with credentials. They know so much. They have so many experiences. They have made so many contacts. And as Alex said, it's people like this and people like you that allow us to be in all of the rooms across the nation so that we get what Gillian's organization says. We want to get to healthcare now. And so as people are sitting up here, it looks like we have Alan Minsky, Dr. Sue, we have Bill Manley and Dr. Edison Under. So those are our first people.
Almost fast later.
I began lots and lots of credentials here. Over in that, Alan Minsky began with the rest of the and then Dr. Sue, I don't know how you want to do that, but on my list I have Dr. Walter Sue, who is a board advisor of the national program, and he's the past president of the American Public Health Association. He's really got some connections with UPenn, Hopkins, and National University. I have Rachel Matley, a director of policy and advocacy center for and democracy. I am so grateful to see you. I'm happy to see that, and she works exposing. I like this part. Yeah, exposing the CEOs and big corporations manipulating our healthcare system. So we're happy to have you here. And then Dr. Nessinger, and representing the nursing, and she has been the founder of the Physicians for a National Health Program Florida chapter. And we're so grateful to have all of you. And you take it.
Thank you, Alan Minsky, Progressive Democrats of America. Look, National Nurses United is one of the great institutions in this country. Please do everything you can to support their analysis of the society's spot. Same for healthcare now. Okay, and I'm saying that as a prelude to what I'm about to say, because I'm also going to say this. First point I'm going to make, just to be a little bit challenging, is going to probably be not the most popular thing most Americans would want to hear, but I think the Democratic Party remains probably the most important institution in society, not only for everything that we need to make this a just society, but also for achieving what we want to achieve in this time, which is a single payer, universal health care. Everything else has to eventually channel, because we have a two-party system. That's not going to change, folks. I know that everybody's tremendously dissatisfied recently with the Democratic Party, with great reason. There's a split in the party between the Field and the progressive faction. We need the progressive action, the Democratic Party, to be ascendant through the movement that Alex outlines. That's how we're going to achieve this. We're not going to see a split in the two-party system. It's not going to be in the ascendant Green Party. Sorry, Working Families Party. It's a great strategy, but they're going to remain inside the Democratic Party because the you know what's going to bring opposite when the alternative is fascist. So that's simply not happening now, and it's not going to happen for other reasons anyway. And so we have a battle with the Democratic Party, and as such, I also would like to parallel with supporting healthcare now and that everybody consider looking into Progressive Democrats of America at pdamerica.org, signing up and joining with us. We're a grassroots organization. And I think we're the strongest organization that has a wedge inside the Democratic Party fighting for the progressive cause. I think if you want to know our influence, we were the sole national organization to draft Bernie Sanders to run for president in 2013. And of course, we reintroduce Medicare for all into the national discourse to the level now. But it's even more than that, folks. And now on December 11th, the DNC is going to be meeting in Los Angeles, my hometown. So I've organized an event at the United Teachers Los Angeles, and I'll speak there. And I was going to hold this until that event, but here's the central theme of it. We have to recognize in modern industrial technological societies that we live in, there's only one organizational strategy for the society that produces a broadly prosperous middle-class society. Make America great again. That's what we. It's only one way to do it, because that's, of course, in many ways referring back to the great post-war prosperity of the 1950s and 1960s, right? We all know that resonance. We all know it has a Republican racist resonance. The Trump people have. But I would say that the idea that America has slipped from its peak to where it is today, with all of the pathological problems that contemporary America has, is because the organization of the society that was implemented with the Roosevelt administration has been chipped away the last 45 years with the ascendance of the Thatcherite and Reaganite neoliberalism. There are about 20 countries in the world that are on the same as the United States prosperity and their liberal democracies. All of them basically adopted the Rooseveltian social or organizational strategy of World War II. Sometimes the United States imposed on them. Of the other 19 countries, they all have single-payer universal health care. All of them also do not have deep entrenched poverty inside their society. They have had some of the social contract pulled apart under neoliberalism to no extent like the United States. Hence, they do not have a third to 40% of their population living either in abject poverty or near poverty. Also, the 40% above that, even 45% in the United States, struggle to make ends meet, and the American dream seems dead to them. Now, if you look at the countries we're talking about, Australia, New Zealand, Taiwan, Singapore, South Korea, Japan, Western Europe, and Canada, they all are much more stable. They have better education systems. They all have single-payer universal health care. The American population needs to understand the only way we're going to get the American society that 90% of our population wants, I mean, this is majoritarian politics, the max, is through the basically adoption of the NNU, Bernie Sanders, strategy for social organization. And there's no issue here more central to it than Medicare for all. Okay. I think if you look at the Mount Gandhi campaign and the affordability argument. This has incredible resonance across the country, New York City, but you see it with Sanders and his popularity across red state America and the incredible traction he has. And so to make clear to the general population that we need this social organization of the Rooseveltian strategy, call it whatever you want. You know, maybe it's not popular to say democratic socialism or even social democracy. You talk about the legacy of the FDR. And what we built, now there's a lot of resistance to it because we've been hit by about 5 decades of propaganda from Ronald Reagan saying those students word of set of words in the English language is where the government here, we're here to help you. Well, Medicare for all is probably the biggest battle. I see there are probably 4 big ticket items that really, really undermine the middle class's access to the American dream, and they are, you know, check the cost of having a child in the country, cost of housing, cost of higher education, and then the healthcare system. Of those 4, the heaviest is the healthcare system. It's also the one that needs the most. Okay, so everything that's being said in this conference is absolutely spot on. But I do think because of our frustration with the Democratic Party, because it's basically controlled by an alliance, finance capital, and insurance companies are financial institutions. Okay. And so that's how deeply entrenched the connection is from the Clintonite wing of the Democratic Party to the financial industries and the domination of the financial industries in American politics. And so we have a battle of the people inside the Democratic Party, because the Republican Party is lost to us. Now, there are many people who vote for it that will support our positions, and we have to draw them into a basically working class alliance. And there are, of course, it's not, as I said, 85% of the population should be with us if they want to have the type of American society that I think really is what people want. So one way to get there, which is again the kind of Rooseveltian social democratic social organizations. Doesn't mean it's the end of history. You get there and just push them, right? But there's no doubt if we're going to get the society back on path, those are the kind of policies that we have to have. And there's only one channel to achieve that, which is inside the Democratic Party, is through the takeover of the Democratic Party by a broadly working, pro-working class, pro-middle class, a coalition that would represent vast majority. Say about the difficulty of we would have to encounter taking of Medicare for all, the arguments will have to be as we go up against forces of very wealthy people and finance capital. But I'll leave that to the panel side because the reason to bring those up is to make clear those nothing cannot be back down force of
our transplants from Philadelphia. So we're pleased that they come back as a homecoming for you. I've been working, as you can tell by my gray hair, on this issue around single payer for many, many years, over 35 years, which may be older than some of you in this room. I even knew at Marilyn Clements, so shows you how long I've been doing this. Let me talk. I've given lots of talks about single payer. And as Alex and Alan have just pointed out, we're at a very propitious moment, if you will, in the whole debate, because we are witnessing in front of us the entire dismantling of our healthcare system. We're about to see what might happen, but the private health insurance, because if we stop paying money, it's about that they're going to be out of is going to be paying and doctors are going to be raising rates because there's going to be a pool of people who don't have. So what does it all mean? It means that all of us are watching as sort of this death spiral, if you will, as it becomes much more unaffordable to buy health insurance. And it's going to be a propitious moment that all of us need to hear about what can we do about this. And last week in the Washington Post, Governor Trump said, interestingly enough, I don't want to give money to the private insurance companies. They're just going to, raise the rates about this. I'm going to give money to the American people through health savings accounts, as if you're the ability to negotiate your healthcare costs. And that's going to obviously people can't afford their hospital bills. So I think for healthcare and single payer is even stronger than ever. I've been talking about single payer for years, as I say, and I don't think it works anymore because people do not understand single payer. They don't understand health policy. They don't understand what is the mission of healthcare in this country. Because if I asked you, what is the mission of our healthcare system? My guess is that most of you could not answer that question, or you would raise your hand and say, well, you have money, you have healthcare. That's about as far as we can go in this country. Let me propose something different as what I want to talk, which is that healthcare is a public good. It's not a market commodity. Healthcare is a public good. It is not a market commodity.
That's right.
If we get the American people to understand that healthcare is a public good and not a market commodity, I think it actually lends itself to adopting the idea of a single payer system. The Gallup poll showed that something like 9% of the American people already support the idea that the federal government has a responsibility to assure access to care for all Americans. So the truth is even like 40% of Republicans think that way. The truth is that on a very basic level, healthcare for all, Medicare for all, is actually a Republican healthcare plan. Because unlike the Republican plans, every Republican would be covered by a single payer system. And I tell my Republican friends, that's what you should be doing. You should be fighting for a system that actually covers every Republican. It just so happens it would cover everybody else. It's also a system, if you will, that would include every member of Congress, all their members of all their family, Jeff Bezos, who lives here in Florida, Bill Gates, Elon, do I say anymore? I mean, the truth is that Elon with all his 12 children, I mean, they're all would be covered by a single payer plan. And it's the fact that the elite and rich are a part of the system that allows us to assure that there's at least some adequate funding for a system which their own family members must participate in. If we believe that healthcare is a public good, then we fund it like other healthcare public goods, like national defense, roads and bridges, your police, your schools, your public education, public health. And that means, frankly, that you see tax dollars are being used to help fund these things. And if we believe that tax dollars could be a way in which we could fund healthcare as a public good, then it makes the transition about the question, how are we going to fund this? Who's going to pay for this? Well, how do you fund other public goods? You fund it through your tax dollars. Well, how are we going to get the money to pay for your tax dollars? This is where American people they can't understand this. If you stop paying health insurance premiums, which right now is something like $13,000 to $14,000, or maybe even more for a family plan, then you can actually have the money to raise your salaries so that even if you have to pay a little bit more in taxes, even a few $1,000s more in taxes, it's not as much as the $13,000 that they would add to your salaries. So the point here is that it's a hard transition for us to mentally think about. But the truth is that it becomes much more affordable. And think about what it would mean if we actually had a national to actually tell you where all the patients that had, let's say, COVID, and how many of them were vaccinated. At the time, we had no idea what worked and what didn't work. Does hydroxychloroquine work? Does ivermectin work? We could answer those questions if we had a national database and we could look at those possible therapies. But The truth is that we can't do that because we don't have a national database and we can't tell you how many people have COVID or flu or any other things because unlike other countries, we had to go to Israel and England and other countries to figure out the COVID data that would inform us about what treatments work. I can go on and on. The point here is that if we had a public good, as healthcare is a public good, we would have a national database, a way to fund for it, like we fund other public goods, and it would actually transform how we would think about healthcare in this country. Thank you.
Hi, everyone. It's really great to be with you today. I am Rachel Madley. I am the Director of Policy and Advocacy at the Center for Health and Democracy. And first, I just wanted to thank our wonderful organizers, Gillian, Stephan, and Alex, for bringing us all together in such an important time. I am so excited to be in this room with all of you. I have been in this fight for single payer Medicare for all, diagnosed with type 1 diabetes as a teenager. And through being insured and underinsured, really got a crash course in the cruelty of our healthcare system. I have had the honor of working inside the Medicare for All movement through Students for a National Health Program or SNAP, where I got my start. And now at Center for Health and Democracy, also had the honor of serving as health policy advisor to Congresswoman Pramila Jayapal and overseeing the reintroduction of the Medicare for All Act. So, and through all of that work, it really feels like we are, it can feel like we're constantly on the defense with Medicaid cuts, the ACA subsidies lapsing and expiring and things like that. But through my decade now of work on this, we are making some of the biggest gains in years in this fight. They're just not front page news right now. And so I really want to illustrate an example of that and then talk about where we're going as a movement of the Center for Health and Democracy. So many of you probably know that Medicare Advantage is essentially a front door into privatization of the Medicare system. It is when companies administer Medicare plans. There has been so much documented abuse and waste in this system from the private insurance industry. They are being over $1 billion a year. And a lot of organizations have been ringing alarm on that and pushing to be made. And so in 2023, Congressman Jayapal led a letter with 70 other members of Congress calling for changes to rein in these abuses from the insurance industry. And a lot of advocacy from people in this room made that happen. Long story short, CMS finalized changes that were not everything that we wanted, but they were steps to kind of getting at this overpayment issue. Now, the really important part is that United Health Group just told their Wall Street investors a few weeks ago that when the changes are fully implemented in 2026, it will cost them $6 billion in just 1 year alone. So, that's $6 billion that they're not going to be using to mislead seniors and people with disabilities to get them into their plan. They're not going to be using that money to lobby Congress and continue gaming with our healthcare. They're not going to be using that money to line their own pockets and to buy back their own stock. And so this really shows that although it can feel like this fight has taken way longer than it should have, we are weakening our biggest opponent to Medicare for All. We are traditional Medicare, which is the foundation for Medicare for All system, and we're shifting power. The people in this room did that, and we're going to continue to do that. And so, and as some of their speakers have pointed out, we're starting to see folks on the Republican side who typically don't talk about Medicare for All turn against big insurance companies. We're seeing elected officials post on social media that they're money sucking and they're out of control. And although we don't agree on solutions, the frustration that they're feeling from their constituents is frustration that we can organize and use this momentum to continue pushing forward. So in democracy, we are focusing on big insurance as the single biggest opponent to Medicare for all. And we're looking at a two-pronged approach to move the fight forward. The first approach is to weaken the big insurance industry and the power that they have over DC and build the runway for Medicare for all. We are looking at ways to stop vertical consolidation, which is when insurance companies buy up doctors and pharmacies and home care companies. Because if United Health or other big insurance companies can buy all the doctors in America, Medicare for all becomes impossible. And there are bills, partisan support that could realistically move forward within the next few years. So we're pushing on that because we feel that without those bills, we cannot get to Medicare for all. We're also tracking campaign contributions and lobbying expenditures from big insurance companies because we have to understand how they're influencing DC in order to take that down. We have to make it public which members of Congress are accepting money from big.
Yeah.
We're also working to, again, protect and strengthen traditional Medicare because there are interests that are trying to get into that sacred public program, and we cannot build Medicare for all on a foundation that has been hollowed out. So the second part of our push is obviously pushing Medicare for all forward. One big thing that we do, thanks to our founder, Wendell Potter, who is an insurance executive turned whistleblower, is we are constantly monitoring new methods that insurance companies are using to profiteer off of our healthcare and constantly thinking, how do we safeguard this Medicare for all system from that happening? We're also constantly connecting current problems, as many people in this room are, to Medicare for all, also building trust in public health. Talking about how prior authorization is a Medicare, it also lower administration and things like that. And finally, we're making sure we are always at the table. Even coalitions that are not for all, Medicare for all organizations because if there could be a so in this strategy, there's 3 key questions. Looking at policies and things that are happening. 1, does a policy expand or improve patients? 2, does it take power away from big insurance companies? And 3, does it move us closer to Medicare for all? If the answer to all 3 is yes, we fight for it. If it's no, we fix it or we stop it. So in closing, I just want to reiterate that we are winning victories, even if it's not front page news and even if it feels way too slow. And I feel like it is way too slow and it can be frustrating. But although the healthcare crisis is real, so is our progress. United Health Group, Aetna, Cigna, Humana, and the big insurance companies are losing billions of dollars. And that's because of the work of people in this room. Woo! We are defending traditional Medicare, and big insurance is on its back foot because we put it there. And so I'm really excited to join all of you this weekend in thinking about how do we harness that momentum, write out our strategy for the next few years, take on big insurance and win Medicare for all. Thank you.
Hi, good morning, everybody. It is so good to see you here, and I'm glad to be saying a few words about the economics of Medicare for all. I am a nurse, currently a nurse, but I'm practicing. I practiced for 25 years, and I went and got my PhD in economics. So I'm a nurse economist. And so I'm going to talk about some myths that healthcare for all is neither necessary or feasible. And so let's start with the necessary part, and let's look at, and of course I can't see, so I have no idea where you're at. It's really weird not being able to include your own slides. Medicare for all is an economic necessity. The myth says this is not true. Let's see. Next. Okay. This is a slide. This was a study done by the Commonwealth, and they took, and it was a survey and examined data on a number of countries in the world. We are here comparing the US to 9 other high-income countries. And on the y-axis, which I'd like to have a pointer to show, the one that goes up and down, the higher you go, the better your health system performance. And that included a number of variables: access, quality, wait times, et cetera. And on the access is the costs. So what you want to be up in the upper left-hand corner. Most of these are high up, but they do have, it's costly to run healthcare systems. So there's a whole group of countries that are sort of in the middle and but up and high. There's the US, down away from everybody else. We have extremely high healthcare costs, and we get very little for it in terms of quality, access, et cetera. This is actually an economic concept. It's a concept of value, in which you look at how much are you getting for how much that you pay for it. And we're not getting much. Next slide. And you could just go ahead and hit the button until all of the stuff comes up, because it'll be easier for you to go through it that way, since I don't control it. So, so the next thing to talk about is what's involved in some of the myths in terms of not needing healthcare, and also in terms of feasibility and not needing Medicare for all. And one of them is that the market will solve all the problems. And as we can see in the slide before, we don't look too good. And one of the reasons why we're not doing too good in terms of having a market, for-profit market for healthcare, is the administrative costs that are involved in it. Medicare for all would have lower insurance overhead. U.S. private insurance has 12% overhead. Medicare has 2%. Canada has a single payer system. That profits would be system. So 4.5% insurance profit, and then there's some small profits that hospitals make, and et cetera, et cetera. So they're extracted from the system throughout, and they add up. There would be physician and hospital administrative costs, and both of those entities have to hire whole departments to handle the administrative costs associated with multiple insurance companies and multiple insurance billing that they do for their patients. So this would be much cheaper too in a Medicare for all system. Hospitals can also be paid on a global basis, which means that they would be paid annually, and out of that they would be covering all the care. So there's no separate billing for patients and and what is really so this will lower and just get negotiating the product providers such as health. So this is something the Trump administration I seriously doubt it will ever come to pass. But under Medicare for all, we could have that buying power to negotiate prices with insurance companies, with insurance, and with pharmaceutical companies. And finally, Medicare for all system could focus on the less cost front. So we would have more preventive, more public health, more effective services instead of less overhang on different types of services, and also we would at the same time deal with the social determinants of health, and poverty, and other environmental causes of poor health. Slide. So, is it feasible? Excellent. So we have to look at what are these going to be. Even though we're going to be money in many aspects, we've got currently uninsured people that we would need to cover. at the time that this study was done, this is a study by Pollen et al. In 2019. Let's see, so we'll leave it at 12. That somehow. Well, on the savings side, I hinted at with the prior slide, we have 9% we say administrative costs, lower administrative costs with Medicare. Have lower pharmaceutical pricing. I put that down more. Deal and the precursors to a lot of our illnesses, the drugs we're going to need. And we need to learn all of our use of drugs anyway. So how much drugs we're using, what their costs are, all of that could change or a more rational system. To cost due to uniformly having provider rates, which would mean right now we have providers paid differently based on whether they're getting paid by insurance companies or Medicare or Medicaid or some other health insurance. Hospitals are, say, for example, upcoding, where they're actually charging, they're actually finding something about the patient's that they can get to the code that will make Medicare or Medicaid pay, or insurance companies that are paying more for their care. And all of that would go by the wayside if, for one, we had little budgets for hospitals. So they get paid a certain amount and there's no bill with patient care. So that's the fraud. The waste is trickier to deal with in terms of the fact that it has to do with overlap and having multiple providers and a good coordination. Back in 2019, there were also a petition went around, or a letter went around to economists, and 253 economists, and economists are tend to be very conservative people, but 253 economists signed the letter supporting Medicare for all, way back many years ago. And after that letter went around, there was a counter letter by typically conservative group, only 50 economists signed that. So we had more sign for in support of Medicare for all than were against it back in those years. And finally, it's affordable. These studies that show that it would pay for itself within a year or 10 years also find that the concern is how much would it cost per person. One is how much would it cost overall, and the other is how much would it cost per person. Well, per person, it would be more affordable too, for most people. Of course, if you're high income, you're going to be, which I'll show you, can move to the next slide. You're going to be taxed accordingly to on a progressive scale. One at a time. I so artfully did these slides so they would go one at a time. I can't have any control.
Please explain.
Happy finger.
My PhD is not in advancing slides.
So how would we finance it? I have not seen my time. My time's not up yet. Okay. I'm almost done. How do we finance it? Bring in the existing spending on healthcare. We already have Medicare, we have Medicaid, we have CHIP, we have the Veterans Health Association or Veterans Health Administration, we have the Indian Health Service. All of these are already funding healthcare. They're either federal or state funds of healthcare. Put those in a pot. We got that. Next one. Might as well put them all up. Next one, replace the existing household spending on premiums with progressive taxes. So instead of and this is what I think Dr. Sue was mentioning, is that can't we let people understand that they're paying so much in premiums already and their employer is paying on premiums and there's all this money that's going into their health care. It's going to be less if we make it a Medicare for all system and we just have some progressive income taxes that pay for our health care. So we add some progressive taxes, get rid of premiums, and that's another bucket. And then the final bucket is a payroll tax on employers, because right now they're paying, if they're a certain size employer, they're paying quite a bit for their premiums for healthcare. So employers would then put their piece in with a payroll tax. So easy peasy, three different buckets. Put it together, we'll have enough to cover Medicare for all. On a slide. The impediment to fundamental reform in healthcare financing is not economic, but political.
So we have had this powerhouse panel of Minsky, Sue, Madley, and Unruh. And in 5 or 10 minutes, they were able to give you everything you need to know. We have time for 2 questions? No way. So before we go to those, and before we go to those video and welcomes, is there somebody who has a question? I do want to say that I'm so grateful to hear, if I'm understanding correctly, forgive me if I'm wrong, it sounds to me that if we make healthcare a public good, then we could build on the advances that Ms. Medley has told us about, that we have been making advances and continuing to do that. We can then make it known that it is economically feasible to have Medicare for all. And then these progressive Democrats are going to be all over the place making it happen. Is that what you would say? Does that So this is a question that anybody would like, okay, one there and then one there, okay?
Julia, as you said, would you move us into that spread that you showed earlier of cost benefit ratios?
Cost benefit ratios?
Spread, yes. You had a diagram where you had 9 countries.
Yes.
And we're down here, and it didn't seem like the numbers would move you quite into that spread.
I'm not sure I understand. Okay, we have, we can't go back, but we have all the countries grouped where they had pretty high performance and moderate costs. They were sort of in the middle on costs. And the US had crappy performance and very high costs. So your question is, Okay, Medicare for all, we'd probably be up with those other countries, which is,
That's worth considering. Quantitatively.
yep.
Okay. And also, I would add one sentence, the people in Australia and the Netherlands, way up in the left, they live in a society where they believe their society cares about their lives. That's not the case in the United States.
And I just want to add really quickly to your point about looking at it quantitatively. There have actually been studies, one in particular, that show that lung cancer diagnoses spike at age 65 and then they go back down. And what they found was that people were waiting to get the cancer screenings that they needed until they were on Medicare. And so there's a lot of related studies that show that people are delaying care until they get there. And things like cancer, the earlier we can detect it and move to a preventative system, the more we can make people healthier. So there is some quantitative data, but I agree it'd be great to have some more.
See anything? And then one question, can you say it really loud?
Yes, I can. I would like to know if you could send me that show so I can make presentations back home.
So my guess is we want all of this information out there. Yes, ma'am.
I'd like to ask the last speaker. You said that with Medicare for all, it could use the payment annually to the hospitals. And so I'd like to know how you compare this with the actual called capitation that private insurance use, and it's crappy.
Yes.
My experience is that, for example, the doctor's offices and hospitals, or whatever, they hold the money and they don't use on the patients because they have the whole, for example, you're gonna have $10,000 for this patient for the whole year. And then they just don't order, you don't need a mammogram anymore because of your age. No, you're good with your blood work because as much as they keep, you know.
Okay, so you're talking about,
They use it less with the patient.
you're talking about accountable care organizations that have a hospital and doctor's offices and maybe even nursing homes in it. And financing system for that is that the money is channeled all into the.
It's called capitation.
It's called capitation, right. Well, there's various ways to capitate. This is an overall capitation system that you're speaking of, where it's shared between all the providers, all of them, including the doctors in the hospital and nursing homes, et cetera. You're right, it's crappy. Because whoever first gets the money keeps their hands on it and doesn't distribute it. And the worst latest thing is adding nursing homes, because now the nursing homes don't get anything. So no, that's not what we're talking about with this. This is direct payments, and we didn't address this. Most of these studies on the economics of Medicare for all do not address how to pay physicians. A lot of them are assuming physicians are continued to pay fee for service, like,
Because you mentioned annual.
well, the annual is for the hospital, and the only reason to do that is to get rid of this billing for each patient, and to try to get and to get rid of the upcoding and the kinds of fraud that exists at this point. Which I mentioned hospitals, it also happens with doctors' offices. I have, from my own experience, an example of fraud and some treatment that I received. But with hospitals, and it doesn't have to be a global budget. We don't have to pay hospitals this way. It is one other way to save money, but we don't necessarily have to do it. But if you try another method, such as DRG, I mean, the next probably best thing would be diagnostic related groups, which is what we have now. And hospitals are paid based on what the patient came in with, the condition they had, or the disease they had. That gets back to billing again, and that gets back to coding and upcoding. So this is something to talk about as we build financing for Medicare for all. It's not that we have to go into global billing, yeah.
Yes. Because there's so much
Yes, I just want to add also to that question. The Medicare for All Act has guardrails built in against some of the stuff that you're talking about as well. So if a hospital is paid on a global budget system, if they have money left over at the year, they do not get to keep it. It all has to go back. And so the misaligned incentives that we see in capitation don't exist because usually they get to keep a percentage of those savings that they didn't spend. And also for things like capital projects, so if a hospital wants to build a new wing or something like that, that will be separately funded. So again, they can't take it out of the global budget. So there are some of those guardrails built into the bill. And I think every time it's introduced, more and more guardrails are being added to react to things like you're pointing out where we see, bad results from capitation and new methods.
We do have one question from the internet. Judith Rice wants to know, what about the Stark Law? All right, it looks like we're gonna have to think some more on that too. Really appreciate it, and we will get back to you later, okay? Thank you.
Thank you so much.
Thank you so much, to our panel. Thank you. Thank you for coming and speaking, dropping all that knowledge on us. Hey, I want to first thank everyone out here as well for putting the oxygen mask on yourself, right? Self-care is everything, and then we can go out there and heal the world. Yes, I am unicorn. All right, so we're gonna go back around to our video greetings. Our first video greeting is U.S. Representative, Paramel Jampamel.
From Village Eye.
Yes.
Let's all say it together, folks.
One more time.
Run. All right.
All right, Representative Washington introduced the National Medicare for All bill in the House for the past 2 sessions.
In the House of Representatives. Thank you to Healthcare Now for having me. It is great to be with you at your annual Medicare for All National Strategy Conference. This group has known for a very long time that America's health system is broken, that it is more of a sick care system. And in the richest country in the world, it is criminal that 85 million Americans are uninsured or underinsured, and that 1 in 3 Americans has medical debt totaling $220 billion. All while the top 5 private insurance companies have pocketed $370 billion in profits over the last decade. Whatever it was before, even the healthcare that we have now is being decimated by the Trump administration and scammed by the private health insurance companies. The Republican Big Bad Betrayal Bill passed in July of this year is estimated to kick 15 million Americans off their healthcare with a massive $1 trillion cut to Medicaid. And in addition, the Republicans' refusal to extend the Affordable Care Act's tax credits will double and triple the cost of health insurance premiums for 22 million Americans, including that it will lead 5 million Americans to losing their health insurance by 2027. And that number steadily increases over the following years. We could well be in a situation in a few years where half of Americans are uninsured or underinsured. At the same time, the private insurance companies have figured out multiple ways to scam the current system to gain even more profits, from vertically integrating the clinics so that they can collect profits both at the insurance level and at the clinic level by forcing pre-authorizations by doctors who have been hired by insurance companies to pad their profits, and by continuing to raise premiums even as they take subsidies from taxpayers to those premium costs. With the cuts to Medicaid, rural hospitals are closing, and more Americans simply have no access to healthcare at all. On top of all of that, efforts to privatize Medicare through Medicare Advantage plans and increasingly restrictive provisions on seniors are being sped up under this administration. All of this is to increase the profiteering of health insurance companies at taxpayer pain and expense, so that the CEOs and the stockholders can get richer and richer while you pay more and get sicker. If there is any silver lining in all of this pain, it is that interest in a universal healthcare system is actually increasing. We can't just fight back against the constant attacks from Trump and Republicans on the healthcare that we currently have. We also have to rebuild our healthcare system from the bottom up. And out of the ashes of this destruction, create a system that actually provides comprehensive healthcare for everyone, from birth to death, when you need it, where you need it, not dependent on your job or your zip code. My Medicare for All bill with Senator Bernie Sanders is the only proposal for universal health care in all of Congress. We reintroduced the bill again this spring with 104 members signing on at introduction, and we are now at 106 co-sponsors, with the most recent bill, Dr. from Alabama, who said to me that he got on because healthcare in Alabama has collapsed and you simply can't be, quote, too left on healthcare. My Medicare for All PAC is doing new national polling, including oversampling in tough districts where candidates may often be reluctant to sign on to Medicare for All. We are so encouraged that there is a big opening this year to talk about our proposal for universal healthcare and to help educate people about what it is, how it can solve healthcare in this country at this moment, how much less it would cost Americans as a whole, and how much wellness it would produce. Because the American people are actually with us. But to do this, we really need your help. We have 213 Democratic members, and we need to increase the number of co-sponsors. To do that, they may need to hear from their constituents. They need to see organizing on the ground, city council resolutions advocating for Medicare for All, even local hospitals or associations of medical providers, or local unions pushing hard to come on board. Our numbers and our movement have grown because of your work. And now we have another opening, an opportunity to redouble our efforts and break through at a time when healthcare is so inaccessible and unaffordable to so many. Medicare for All is the only real proposal to transform our healthcare system, expand a very successful existing program so that it covers everyone and expands to cover everything, including mental, reproductive, dental, hearing, and vision care, as well as long-term care. It would, for the first time, put patients over profits. Despite all of the attacks from private insurance companies, it remains extremely popular, with the majority of Americans supporting it and over 100 cities and counties passing their own Medicare for All resolutions. But our polling also shows that the support can sometimes be fragile because the misinformation about Medicare for All is so high. People get worried by the attacks they see. Will my own costs go up? Will I not be able to see the doctor that I need to see? Will I end up waiting a long time for my health care? How does it really work? These are the fears that have been put into the minds of people. So our job is to alleviate those fears. Make sure that people actually understand not just the slogan Medicare for All, but the actual way in which it works. Deeper education about the system and why it's important. That's our fight. Now, getting the legislation passed is going to be an uphill battle. We have to build support from the ground up. No matter if we're talking about state or federal single-payer healthcare, we are talking about the same principle: healthcare being a human right. State-based plans show us what can be done in the effort to provide comprehensive healthcare at a large scale, serving as a model for what a country with guaranteed healthcare could look like. They also give us momentum in our push for federal Medicare for All legislation. So as we collectively organize and mobilize for universal healthcare, let's keep fighting back against Trump's attacks on Medicaid and Medicare, and for a healthcare system that actually works for everyone. Medicare for All is not just possible, it is so necessary. And you are the agents of change making that possibility a reality. So thank you all so much for your hard work, and let's go get this done.
I'm hyped up. I'm so hyped. I'll go in debating, but I'm gonna have us do a quick chance.
Yes.
You know, because it's such an informational day. So when I say four, you say all. Form. Form. We got our blood going. That's just, that's what I'm talking about. All right, so we have another video greeting, and this is U.S. Senator Ed Markey, and represents Massachusetts, a long time health.
Hello, everyone. I'm Senator Redmond.
Jeez, how much? Yeah. Fingers are really
Party. And I'm thrilled to join you in the fight for Medicare football. And thank you to the National Nurses United, Physicians for a National Health Program, California Nurses Association, and Medicare for All Florida for building the healthcare resistance and hosting this incredibly important, incredibly timely conference. And thank you to the healthcare providers, advocates, and patients here today who are tirelessly fighting for a more just healthcare system for everyone. For over a month, MAGA Republicans have been shutting down the government rather than extending the Affordable Care Act tax credits that made health insurance coverage attainable for 22 million Americans. They would shut the government down over that. Just absolutely unconscionable. And millions of those American families are going to be forced to trade their health care for tax breaks for billionaires, including over 337,000 people in my home state of Massachusetts. We cannot allow Americans' health to be sacrificed to pad CEO billionaires' wallets. In the richest country in the world, it is a great injustice that millions of people lack access to affordable health care. Last year, 27 million Americans were uninsured. Millions more risk financial ruin if they face unforeseen medical emergencies or a devastating diagnosis. Our healthcare system, in fact, our entire economy are under threat from corporate greed. But our healthcare system is not and should never be for sale. If this Republican shutdown has shown us anything, it has reemphasized the urgent need for action on Medicare for all. The Medicare for All Act would ensure universal care, regardless of a person's ability to pay, and I am proud to champion this incredibly vital legislation. We must continue to work towards a system where Americans' health care comes before corporate wealth. As my father used to say, you can't beg for your rights. You've got to take them, Eddie. And that's what's happening. We just got to stand up. We got to fight for it because healthcare is a human right. It is time we organize, put patients over profit, and pass Medicare for all. So thank you for having us.
Yeah.
Let's get the work done. You are doing God's work here on earth. Thank you.
I'm gonna put my hand up and I'm asking you to hold until we introduce this next video. Just so that you know. So, we have here in Florida, one might not think that we have any Medicare for all advocates, but we have them. And we're so proud to have, as a Florida senator, Carlos Guillermo Smith, speak to us on this. But what's so cool about it is he has helped us to introduce the Healthy Florida Act here in Florida, and he has introduced 2 Medicare for All Florida bills. So we are so proud that he is able to give us a welcome here and talk to us a little bit. This is State Senator Carlos Guillermo Smith. Take it away.
Hey everyone, this is State Senator Carlos Guillermo Smith. Thank you so much for inviting me to be a part of this really important Medicare for All conference in Rockledge. I am so sorry that I can't be with you in person today, but I'm just really grateful to join you by video and to stand in solidarity with you all who are fighting for a fair, humane healthcare system in Florida that is so needed. We all know Floridians are living through an affordability crisis, and people are getting hit from every angle, from rising housing costs, property insurance spikes, the cost of groceries and utilities. But nowhere is that crisis more personal and more painful than in healthcare. Everywhere I go, I hear the same stories. People are skipping doctor visits because the copay is too high. Parents are cutting pills in half to stretch their prescriptions. Seniors are trying to make one vial of insulin last longer than it safely should because they simply can't afford the next refill. One unexpected illness or emergency room visit for so many families can actually push the entire family into medical debt that takes years to climb out of if they ever do. And that's just not acceptable. It's not acceptable in the richest country in the world and not acceptable in the state of Florida. That's why I filed Senate Bill 222, which directly targets one of the most urgent and critical aspects of this crisis, the cost of diabetes care. Senate Bill 222 puts a hard cap on an out-of-pocket cost for diabetes management under this bill. A health insurance policy in Florida, private health insurance cannot charge more than $35 for a 30-day supply of insulin. Regardless. It also caps the cost sharing for diabetes devices and diabetic ketoacidosis prevention devices at no more than $100 for a 30-day supply. That means insulin, test strips, continuous glucose monitors, syringes, etc. Basically, the basic that people need to stay alive cannot be priced out of reach through sky-high copays and co-insurance. This is about making sure that people with diabetes aren't punished financially just for needing the medicine and devices that keep them healthy and out of the hospital. No Floridian should have to choose between their insulin and their rent. No parent should have to decide whether to pay for their child's diabetes supplies or put gas in the car to go to work. SB 222 is about immediate relief for people, and it's about relief right now when they need it. But we also know that the problem goes beyond insulin. The entire healthcare system is tilted against patients. It's fragmented, confusing, and driven too often by profits over people. That's why I also introduced Senate Bill 348. 348 creates the task force at Universal Healthcare in Florida and directs it to design the Healthcare for All Florida plan, which would be a universal publicly funded system that covers every person in our state. This task force will bring together patients, providers, labor experts, and community voices to think about how Florida really can move to a single payer Medicare for all system that is equitable, affordable, and comprehensive. SB 348 is about doing the homework and building the blueprint for this. How do we ensure everyone has coverage? How do we remove cost barriers to care? How do we protect people from medical debt and financial ruin when they get sick? And how do we make sure that our healthcare dollars go towards healthcare, not to bureaucracy and corporate overhead and executive salaries? Taking together these two bills, SB 222 and 348, are part of the same vision. SB 222 offers immediate concrete relief on the cost of diabetes care, and SB 348 helps us plan and build the long-term transformation that we need, an universal system where healthcare is a right, not a privilege. But here's the reality. I can file these bills, as Medicare for All Florida has encouraged me to do. That's where you all come in. Every single person that's here at this conference that is watching this, you have power, you have a voice. And in this moment, we need you to use it. I'm asking you to contact your state senator and your state reps. Tell them that you support SB 222 because no one should be priced out of insulin or the supplies they need to manage their diabetes. Tell them that you support SB 348 because Florida needs a real plan to move towards universal Medicare for all style coverage. And tell them that you want not just for them to consider the proposals. Tell them that you want them to co-sponsor them and fight for them. Call their offices, send emails, show up at town halls, delegation meetings. And if you're an organization, pass a resolution of support for these bills. Make it clear that doing nothing is not acceptable, that tinkering around the edges while people are rationing insulin and drowning in medical debt is just not enough. We know that this kind of change is possible. It's possible because we've done it before. Medicare didn't just appear out of nowhere. Medicaid didn't just appear out of nowhere. It took organizing, it took movements, it took regular people demanding that their government do better. That's the same energy we need today for insulin affordability, for universal coverage, for Medicare for all in Florida and across the country. I filed these bills because I believe in a Florida where people can actually go to the doctor when they get sick, get the medicine they need, and not worry that a single prescription or hospital visit will wreck their finances and draw them or push them into bankruptcy. It's in the Florida where our healthcare dollars actually go towards helping keep people healthy, not boosting corporate profits. It's a Florida where your income, your zip code, and your pre-existing conditions, they don't determine whether you get care. That's the future I know you're fighting for at this conference. And I want you to know I'm right there with you, alongside you in that fight. So thank you for the work that you're doing across Florida, the educating, the organizing, and pushing for a healthcare system that truly serves the people. And a special thanks to Healthcare Now and Medicare for All Florida for sponsoring this event. Please keep raising your voices. Please keep building pressure and organizing. And please reach out to your lawmakers and tell them to co-sponsor SB 222 and SB 348. I know that together we can make sure that in Florida, no one has to choose between their health and their financial survival. And we can move closer to a true Medicare for all future. Thanks, y'all. Have a good one.
I don't think he mentioned that our own Stephan Ramdohr did a lot of work on writing those bills. Am I correct, Stephan? Stephan, thank you so much. And so once again, that was a state senator, but every time you see Carmela Jayapal, I'll say it right, Carmela Jayapal introducing the Medicare for All Florida Act, Medicare for All Act, oftentimes there's this young man next to her, and the first Gen Z person that's right there, and it makes me so, so proud that that young man is Representative Alejandro Maxwell Frost. I mean, this man is so amazing, and I'm just so grateful that he represents the Florida 10th District, and he has a message for us. I've never heard him speak that I'm not even more inspired than I was the minute before he started. So here he is, Maxwell Frost.
Everybody's Congressman Maxwell Frost, number one. Welcome to Florida, and thank you so much for your advocacy to make sure that we realize what we need in this country, which is Medicare for all. We believe in Medicare for all because we believe it is a human right to have healthcare and to be healthy in this nation. There's so much debate around this and what we're going to do. We saw what just happened with the Affordable Care Act tax subsidies. We're still fighting to make sure that we can extend that. But here's what we do. We extend that so people don't see their healthcare go up 3x. And then we pass Medicare for all to make sure we get to a system where not just everybody has healthcare, but everybody has good quality healthcare that covers you from the top of your head to the bottom of your feet. That is what we need. And guess what? Medicare for all is popular across the entire country, from the most rural parts and even the most conservative parts to the most liberal progressive cities. Most people want universal healthcare via Medicare for all. So let's do the easiest thing. Let's take the most popular government program, Medicare, and make sure that we extend it to everyone. I'm in this fight with you. Let's keep electing Medicare for all champions, and let's make sure that people know about it. Thank you so much for your advocacy, and I hope you have a great conference.
Thank you so much. And now we're back to Ronda.
All right, so we have our second panel, And it is healthcare organizing in Florida, the state of our state. This panel features local Florida speakers who demonstrate how organizing is locally here in Florida.
Yeah, we want to welcome up the whole panel to the front.
Leo. Alonso. And we have Maria Harris. Mitch Emerson. Sam Delgado. Sabina Lights. Lights. And Representative Dottie Joseph. That just happened. All right, so Leo serves on the Board of Physicians for a National Health Program, Florida chapter. He's the former director of the emergency department at Orange Park Medical Center.
Slideshow or panel?
We got you.
Well, hi, everybody. I'm an emergency medicine doctor. I retired last year and then been involved with the for probably 20 years. Stephan for inviting me, and you guys have heard some great ideas. You know, healthcare and Medicare for all is a concept that is like a virus. It spreads, and part of your job as advocates is to explain to people what it's about, because you're gonna hear a lot of myths. So we have the best health system in the world. Compare that over and over with Bush. That person said that I would scroll on my seat. He was telling people about the emergency department for healthcare. You know, so crazy that. And that we don't really have a health system, and we have a health system that's designed to maximize profit. We're very good at that, right? But not provide healthcare for all. So aside from that, I'm gonna focus on what the Florida team has done. You do the next slide.
Why don't you go ahead and catch up?
Oh, okay. So Guillermo Smith kind of beat me to the punch. He talked about three big ones. One is the Medicare, insulin cap of $35. That's a bill that has gotten bipartisan support. There's 25 states that already have it. Several of them are Republican states. Alabama, West Virginia. So that is one that I think we can achieve while in the next year or two. The other two are a little more difficult because I've seen this state become a red state. It was purple for a while, but it was blue when I was young, believe it or not. So the other two are the Healthy Act, Florida Health Act, which talks about providing health care for everybody. And when they say Medicare, they go beyond the current Medicare, which has many faults. Notice it doesn't cover vision, it doesn't cover health, it doesn't cover dental. So the current Medicare has many deficits. So this proposal would be even better than that. It would also cover mental health. And then lastly is the task force, which the state of Oregon is way ahead of us in that. They actually have a task force convened, and I believe in 2026, they're going to start implementing a state single payer health system. So it's going to be interesting because Canada, remember, started their health system in one province, and it worked out. It was a model. Now they have started previously, Vermont and other states have tried them, but they've always been kind of half-assed. They've been kind of crude. And okay, where were the sloths? Yeah, you can see a lot of grassroots lobbying has been done. There's been a few cities like Alachua and Key West that actually did resolutions. Medicare for All and the PHP and other organizations, the SNAP chapter have been amazing.
These are all the coalitions. These are some representatives that have sponsored us at town hall meetings. See some familiar faces. These are, there's Candy up there. And Pat Peely was the snap in Gainesville. He's now studying in New York. The legislation. These are the three main ones that, as you saw, I've already kind of touched upon. There are the states that have implemented the insulin cap, as you see, some are southern conservative states. It's about 50-50 mix. West Virginia did it, Alabama did it, no, they did it. We did it. This is the task force. Stephan asked me to read it. It's very comprehensive, and like I said, it goes beyond. I don't think it's going to happen real soon, but at least it puts the subject on the table, the discussion here. And as you notice, healthcare being a morally just issue is something that you can convert people even if they're on the other side of the aisle, right? Who doesn't want good healthcare for their kids, their family, their loved ones? There's about 2 million uninsured Floridians right now. The population of Florida is about 23 million. We're one of the largest states. What makes us also very distinct is we're a state with a lot of retirees. They all got Medicare, right? So they know what Medicare's like. They remember, like was commented about lung cancer, a lot of people wait till they have Medicare to get healthcare done. And it's interesting, Medicare was implemented in 1965, and we have stats of the elderly healthcare before and after that. The dramatic drop in illnesses and longevity just due to Medicare. So imagine expanding that across the board. All right. We did a lobbying day, about 50 or more people went to Tallahassee and visited a lot of the congressmen and representatives, and they really appreciate this, especially when it's doctors or medical students, because it gives them support. And that's it. Thank you.
Thank you so much, Leo. All right, and we have Representative Rita Harris. She represents Florida's District 44, first elected in 2022 and re-elected in 2024.
Hey, good morning, or actually good afternoon, everybody. So yes, I am Representative Rita Harris. I'm proud to represent House District 44 in the Florida House. And for those that don't know, House District 44 is most of South Orange County, going from Dr. Phillips all the way to Lake Nona. And there's some incredible neighborhoods there. There's also a lot of working class neighborhoods there. A lot of people who do work for the theme parks and hospitality. And I've lived there for over 20 years, and it's a place that I love very deeply. I love the community there. It's a very diverse community. I was going to talk a lot more about some of the things that people have already brought up. And so rather than be redundant, I'm going to tell you a little bit about my story. When I was pregnant with my child, Anissa, who is here today. Yeah, you can hear all the flowers, baby girl. I was uninsured. She was a gift, an unexpected gift. And so I was able to be on Medicaid because I was pregnant. But after I had her, I got diagnosed with, I didn't realize at the time, OCD. And I was dealing with a lot. And because I was not on insurance, my husband and I had to make a lot of difficult decisions. And so one of the decisions that we made, being that SSRIs for things like OCD are really needed. You really need to take them. We decided to pay for my medication every week. And I can tell you how embarrassing and disheartening it was to walk into the pharmacy every week to have to buy 7 pills at a time because I couldn't afford a whole month's supply. The pharmacy, bless him, the pharmacist was very sweet. But he said something that made me feel even more disheartened. He said, "You're not the only one. So many people have to pay for their medication like this. They have to go and buy a short supply, or they have to ration." So when HB 367 was brought to me, and that was the insulin cap, it was a no-brainer for me. Having been in a situation where I knew what it was like to have to ration my own medication, and knowing that insulin is life-saving. It's not good to ration SSRIs, by no means. But it wouldn't kill me if I did. It would be good, but it wouldn't kill me. But for those on insulin, it is literally a life or death choice that you're making. And having heard so many stories from people who had to give up their own medication so their child could have medication, in the case of a parent and a child who both had type 1 diabetes. Having to make that decision, and then the mom ending up in an ICU. I thought to myself, there has got to be a better way. And we know that there is a better way, but we also know that we're in an uphill battle. So if there are things that we can do in the now, while we're waiting to do something much more broad, then I'm willing to do that. And this is something that we can do now that will make a difference in so many people's lives. And like Senator Smith said, what it would do is cap insulin at $35. And it would cap all of the supplies, the diabetic supplies, at 100. And that is one small thing that we can do to help people in the now. And the reason why it's passed in so many red states is, if you look at those red states, there are a lot of working people in those red states. And these policies don't tend to be left or right. They tend to be, how is this going to help me? How is this going to make a difference in my life right now, today? And that has an economic driver behind it. Because I could tell you, when I was struggling buying my pills a week at a time, it really wouldn't have mattered who said, hey, I will make sure that you won't have to pay more than $20 a month for your pills. I would be supportive of that policy, because in that moment I was struggling. And so many people right now in the state of Florida are struggling. We never expanded Medicaid when the ACA came through. So we have terrible options in the state. My own daughter, who is on the ACA right now, her premiums are going from $230 to over $900 a month. That's what people are facing. So I feel like we're in a space where we can really gain some traction when people are seeing what is at risk here, not just for themselves, but so many of their neighbors. But there are a lot of people who are struggling. And I hear from medical professionals all the time as well. We hear from medical professionals all the time how even just not expanding Medicaid in the state has made it difficult for them to practice medicine. How they're forced into, private equity practices because they can't practice on their own. They're not getting reimbursed what they need. I mean, this is really, we are at a critical point here. And so this time and this space is really important for this movement as a whole. Is also an important movement for bills like HB 367. I implore you to please, when you're advocating for the Healthy Florida Act, that you also advocate for that, because while it's smaller, it's still important. And it's a really vital step to getting to the next step, and to getting across the finish line for us all. And that you do tell your personal story. I will tell you, personal stories are the most impactful thing. Numbers and data is important, but there's nothing like going to a committee and telling the lawmakers up there, this is how this bill is going to help me. And especially if you are just not even talking party, if you're talking personal. So I implore you to keep speaking out and keep speaking up. And thank you so much for having me. Thank you.
I've been galvanized. It's great. Thank you so much, Rita. All right, and we have Mitch Emerson. Mitch is the executive director of Florida Decides Healthcare, leading the campaign to get Medicaid expansion on the ballot in Florida.
All right. I'm gonna start by saying Medicaid expansion, I'm assuming most of you in this room are aware of it, but it is the effort to expand Medicaid access to people who make 138% of the federal poverty level or less. But I like to do a little, public participation here. So I'm gonna ask a quick question. If you know the answer, don't guess. I'm looking at you, Scott Marius in the back. Co-chair for State Voices for Health. But he's co-chair for Decides Healthcare. But just a quick guess. It's gonna be two questions. One,
If you are a single adult in the state of Florida without a disability, how much can you currently make and qualify for Medicaid in a year? Just anyone, shout out a number, it's okay. 24,000. Okay, great, got one for 24,000.
10,000.
10,020, okay. Any guess if you are a single mother of two, how much you can make in the state currently and qualify for Medicaid?
14.
30,000?
14.
18, all right. So, as it stands now, if you are a single adult and you have no disability, you do not qualify for Medicaid, period. $0. You make $0 a year. And you currently do not qualify for Medicaid in the state of Florida. If you are a single mother of two, if you make any more than $7,176 a year, you do not qualify for Medicaid in the state of Florida. So, just want to kind of set that at the start. Now, by raising this to 138% of the federal poverty level, that would mean a single adult without disability would be able to qualify for Medicaid if they made $21,597 a year, or a single mother of two, $36,777. Of course, we would like that to be higher, but it is substantially better than the current system. I also want to point out, because I'm sure there'll be a lot of conversations about this, and also guessing all the folks in this room are aware that the ACA premium tax credits that were not expended in the HR 1 or big bill that was passed earlier this year. With the loss of those credits, we expect, based on studies from the Congressional Budget Office, Kaiser Family Foundation, and a number of different studies, currently in Florida, we are about 1 in 10 Floridians are uninsured. That number is going to jump in January to about 1 in 5. About 20% of the state is going to be uninsured. Representative Harris just talked about what cost increases were being faced by her daughter. We're seeing that all across the board, and people are going to be in a position where if you're making $20,000 a year, $25,000 a year, and you're still coming out $200 a month for health insurance, and now you're looking at a charge of $900 a month, it's not a decision. That is your budget for the month. So we are going to see an incredibly high spike of people going uninsured. That is going to result in, we don't have a lot of time, so I'm just gonna say, it will be bad. Hospital closures, people dying, estimated about 7,000 a year every year in Florida because of lack of access to insurance. 50,000 jobs lost within the first year or two from in the healthcare sector. We're going to lose doctors. We're going to see hospital closures, in particular in rural communities. If I get a chance, I'll talk a little bit more about meetings with the hospitals we've had that they're already making. And part of the reason for that is Florida is the largest enrollment through the ACA. We have not by per capita, but more than California, Texas. We have the most people getting their healthcare through the ACA marketplace. 51% of the people who get their healthcare through the ACA marketplace right now in Florida make less than 138% of the federal poverty level, meaning all of those people would have access to healthcare if we expanded Medicaid. So, with that, I know I started on a lot of high notes. I do want to offer a little bit of hope. Right now, we are in effort to get Medicaid expansion on the ballot for 2028. We were working for 2026, but the state legislature passed some legislation called HB 1205 to try and make it harder for citizen-led ballot initiatives like ours to get on the ballot. Don't have time to get into it all, but we are currently fighting that in federal court. We are also preparing that no matter the outcome, we are going to keep moving forward for 2028. And we can start collecting petitions in February 1st. We'll have the new petition start collecting. I want to just bring that to your attention because what we urgently need is for you to get the word out and start being prepared so that on February 1st, we get petitions, we get them signed, and we get them turned in and get them on the ballot as soon as possible. This is something that will address not all of many of the crises we are about to face come January with the loss of these credits. Because again, we are going to see a doubling of the uninsured, rural hospital closures, and longer lines, and for hospitals, an additional $5.2 billion a year in uncompensated care costs, which, to be clear, is costs that are borne by taxpayers to cover those costs. And we're also walking away because of the way Medicaid expansion works. It's a 90% match. Right now, Florida is a donor state, which means we are sending today $4.5 billion a year to other states to cover their Medicaid expansion instead of keeping it here. Come January, when all of these new people will be available for Medicaid expansion, we're looking at over $10 billion a year that could stay in the state to help cover this crisis. Thank you.
Lots to show there. So, all the doctors and nurses here, we are definitely, all of us right now on the front line. So it's up to us to keep this fight going. All right, thank you, Rich, again. And next we have Sam Zalgato. And a community organizer in Orlando area for the last 7 years.
Yeah.
Hey, good afternoon, everybody. I'm Sam Delgado. I'm an organizer with Central Florida Jobs with Justice. And I worked with a lot of the folks actually in the room here today across a couple of different campaigns we've been working on around healthcare, in particular in Orange County, but connecting that throughout our healthcare system in the state. We have part of the Medicaid expansion campaign, for instance. And a lot of that focus is because we are a coalition of labor unions and community organizations and people of conscience throughout Central Florida, who want to fight for systemic changes that will benefit the material conditions of working people where we live. And so the way that we really, got connected within this fight was through relationships with the unions that are part of our membership, namely 1199 SEIU and the Orange County Classroom Teachers Association that really put our attention to how central, I think Alex had put it really, really well in the introduction, right? That how critical healthcare negotiations are when doing collective bargaining agreements and negotiations. It is one of the primary cudgels that employers use to decide the terms of what is actually on the table. And so, with an equitable healthcare system in place, the things that working people are able to fight for, it's like the sky's the limit, right? But as it stands right now in the for-profit healthcare system that we have, we are really limited in what we're able to fight for. And so, one of the things that we do as a coalition is we seek to find issues that connect the many organizations that are a part of our base. And well, everybody that is a part of our base lives in a human body, right? So everybody needs healthcare. And so we want to connect these in ways that people can touch and feel and experience, right? And so one thing that we would encounter during the COVID pandemic was this massive, economic downturn that local governments experience throughout the entire country. And with that, after the passage of the American Rescue Plan Act, local governments got just a massive injection of cash from the federal government that they were able to do a whole lot of creative things with. And, you know, we were enlightened to the fact that Orange County hadn't spent all the money that they got by the middle of 2022. And we were like, okay, that's that, right? And so our allies at Grad Community Change, we met with them over a period of a couple of months, and they connected us with an organization called, well, at that point, it was called RIP Medical Debt. And now they have changed their name to Undo Medical Debts. That's who they are now. And so, you know, we, you know, focus on bringing in community members who have been struggling with, you know, issues around access to healthcare. And we gathered them basically to take this message to the county of ways that they can, you know, better better like deal with the high costs of healthcare. And so what we got the county to do was to reallocate funds that they had through the American Rescue Plan Act to eliminating medical debt for Orange County residents. We were able to basically get them to allocate funds that they had not applied to anything yet towards this effort. And in so doing, you know, calling into question, like, what are the priorities of our local government, and really grounding this in people's lived experience. And so, you know, one of the main factors to that was like identifying how these fights like affect people where they're at. In part, it was like the I'm sorry, like there it is. So basically, like we were able to get people to speak to how, because of the high cost of healthcare, they were, you know, making these tough decisions between, you know, paying a critical bill or going to seek preventative care. And by making that case at the county level repeatedly and saying like, you all have this money available, you should spend it here. We were able to call into question what are the obstacles that local governments encounter, and that they're required to foot the bill, right? And how unfair that is even at the local level, that so much of the county's costs that are paid through Medicaid, they shouldn't be because of the lack of Medicaid expansion. There are local level healthcare provisions that the county is not even able to like fully provide the way that they would like to. And so through this this push to get the county to apply those funds to eliminating people's medical debt, we were basically able to get the county to make further commitments and to acknowledge the lack of support that local governments are getting in meeting the basic needs of people. And most importantly, I think that was through connecting community members to where they can apply pressure and where they can consistently organize year round to call into question these systemic failures that we're encountering, not just at the federal level, but right here at home. And that was really critical, not just to this campaign, but to, you know, the need that we have around the country in activating people, ordinary working people, into these fights, right? Because, you know, Mitch was just talking about the Medicaid expansion bill. We need over 1 million people to sign these petitions to get it on the ballot, right? And so that is like super critical, is getting people's attention towards where they can, you know, put their shoulder to it, right? And connect it not just to where they're at here at home, but that every single level, there are ways that they can consistently apply that pressure. And so, you know, I approach all this work as an organizer, and our main objectives are like to really make it real for people and see how, you know, the everyday person can plug in to advocate for the things that affect everyone. Thank you.
All right, thank you so much, Sam. I'm woke. All right, so, founder of Standing Heroes for Average Workers. Yes, as a young woman, she passed the Tennessee State Board exam, becoming the youngest certified nursing assistant in the program's history. Miss Leo.
Good afternoon. Good afternoon. Yeah. All right, thank you for having me. I'm gonna put this mic up there because. Yeah, I'm telling you. All right, so, thank you for having me and allowing me the opportunity to address this very, very important topic that I have been advocating for quite some time since I've been here in Florida. But what brought me to this advocacy point was because one early morning, I got a call, and it's the kind of waiting for approvals, waiting for a system that moves slower than his heartbeat. That day, I made a promise that no family should ever have to make that kind of choice. A choice between life and a bill. I found it sharp. Standing Heroes for Average Workers, Incorporated, in his honor.
Yeah.
In his honor, but also for every working man and woman who's been told you'll be okay when the system knows you won't. Because healthcare is not a privilege, it is a human right. And I'm not fighting for it because it holds well. I'm fighting for it because my brother's name is written in the margins of this mission. The Constitution commands us to promote the general welfare. Those are not poetic words. They are a moral directive. To promote the general welfare means to care for the people who build this country, the workers, the veterans, the families who keep America moving forward. How can we tell ourselves a nation of freedom when people can't afford to live? How can we swear allegiance to liberty when healthcare depends on your zip code or your income? The right to life is meaningless without the right to live in good health. So I decided to step into the United States Senate race because I knew politicians that were running for this very important position would tell you that they care. They'll tell you that we support healthcare reform, but the truth is we can't reform what you've never had to survive. They've never had a choice to choose between medication and rent. They've never sat by a hospital bed and wondered how to pay for hope. They've never buried a brother because a system decided that its care of cost was too much. And they've never had to console a grieving mother who blamed herself for not having money to pay the insurance companies, where the insurance companies chose not to pay. That's the difference between me and them. They speak from policy, but I speak from pain. They read about struggle, but I've lived it. And because I've lived it, I will fight like hell to change it. When I raised my right hand to serve in the United States Air Force, I promised to protect this country, foreign and domestic, to the Constitution. And when I raise my right hand again as your United States Senator, I will carry my brother's name and yours with me. And I will fight for Medicare for all so that no one dies waiting for coverage. I will fight for accountability for insurance companies so no one is denied care because of profit. I will fight for mental health and veteran care that treats invisible wounds as urgently as they treat the visible ones. And I will fight for prevention and community clinics in working class areas so people don't wait until it's too late. Because it isn't just about health care, it's about dignity. And dignity, my friends, is not up for sale. So today I stand here not as a politician or just the president of my brother's nonprofit, but as a sister, a veteran, and a fighter. The uniform, it may have changed, but the mission remains. The halls of power may be different, but the courage is still the same. And I promise you this, as long as I have voice, and as long as I have breath, I will fight so no one else has to lose what I have lost. Because my brother's story, Shaw's story, is not just my story, it's our story. And together we will write a new ending in an America where healthcare is guaranteed, not gambled, and where workers are protected, not punished. Where we the people truly means all the people. I'm Tamika Lyles. I'm the founder and the president of Shaw. And I'm running for the United States Senate because I volunteered to fight for this country once, and now I'm ready to fight for it again. Not for power, not for privilege, but for the people. Thank you so much.
Thank you so much, Tamika. That's beautiful. Powerful story. Hey, I just want everybody to be patient. Just a couple more minutes. We do have one more fabulous speaker to come to the stage. And then we'll have some lunch. You got a belly? I got a belly. All right, food. In her fourth term representing Florida 108th District, born in Haiti and raised in North Miami, a proud grant of Miami-Dade Public Schools. Mrs. Dottie, Representative Dottie, just. So it's always a pleasant spot to be between you and lunch. So here's the game plan for today. So I'm going to do a little introduction, do some shout outs. We're going to talk about the Healthy Florida Act, which you've heard some about. And I say we going to talk about it because we going to talk about it to be interactive. We're going to talk about Medicaid expansion. We're going to talk about healthcare in general in this state. In terms of organizing, we're going to talk about what we can do now beyond just the legislation. And if we have time, we'll talk about how we got here. Is that good? Sound like a plan? Yeah. All right, good. So I am Dottie Joseph. I have the honor and privilege of representing Florida House District 108, which is entirely in Miami-Dade County. As you heard, I was born in Haiti, raised in Miami-Dade, all public schools all throughout. Had the opportunity to go to Yale undergrad, Georgetown University Law Center. My mommy is a nurse. Half my aunties are nurses. My dad, my uncle's a doctor. So I come from a family of healthcare providers. And my dad's a pastor. So I got service all throughout. So that's my background. Like I was literally born to serve. I couldn't even do anything different. So let's start with a thank you. So shout out to Stephan and everybody for Medicare for All for all that you've been doing. In fact, if you have been in this game, and by this game, I mean advocating for healthcare in some form, shape, or fashion, for more than a year, just raise your hand. All right, I want y'all to stand up. Stand up, give yourself a round of applause. Because this is no joke, right? The fighters up here, it's like watching a video game. Choose your champion, right? Choose your fighter. Because we got some fighters. We need fighters in lots of different worlds. Now, if you've been in there for less than a year, I want you to raise your hand too. Less than a year, you just coming through? No? Everybody's a veteran? Okay, I see you. She did it real shy. She did it down. It's okay. We're not gonna make you stand. But for you, I have this to say. Welcome to the
the healthcare resistance. And so the thank yous, the last thank you I wanted to shout out is Representative Carrie Reingans out of Michigan, who has been working with lots of state legislators around the country to advocate for universal health care. Now, I was involved before what she was doing, but she is working to make sure that we're a little bit more coordinated and knowing what's going on. So that's on the legislative front. Now, speaking of the legislative front, you heard about the Healthy Florida Act. You heard it from Senator, you heard some of the panelists mention it. Tell me, who knows, tell me anything you know that it does. Just raise your hand and I'll call on you and you shout it out. And if you don't raise your hand, I'm just gonna start calling on people. So, teacher hat. All right, what do you know that it does, if anything? I know, I warned you it was gonna happen. So tell me what, anything you know about the Healthy Florida Act. She's looking at her notes.
I don't know which one it is. There's.
Healthy Florida Act, the one comprehensive, okay, go ahead.
Okay, I don't know what it's about specifically, but I trust Stephen, so it probably, or Stephan, it provides comprehensive universal health care for every resident of Florida, not attached to your place of work.
Look at that! It's but you know instinctually what it is, right? Because we know what we're fighting for. So it does, and it covers beyond Medicare for all, which one of the speakers mentioned earlier. It goes over and above that because Medicare has its drawbacks, but we want to make sure that every Floridian is covered, regardless of your employment status, regardless of your immigration status, and you're covered for everything. So not just healthcare, it covers dental, it covers eye care, it covers mental health, right? It limits your out-of-pocket costs. You can go to any doctor without a referral. Like it puts us close to on par with the rest of the world in terms of healthcare. Close. Anyway, go ahead.
I forgot to mention, it also saves your state billions of dollars every year.
Oh yeah, that it does. As with Medicaid expansion. So Medicaid expansion, Florida is one of like 11 or 12 states that has yet to expand Medicaid. And I have been filing this bill for years, and every time I think a different administration might have a different take. But these folks up here in Tallahassee, I have these conversations with the leadership, and I'm like, okay, so how can we fix this? Because we would draw down literally billions of dollars that we leave on the table in terms of federal matching dollars, and they refuse to consider it. And when I ask them why, oh, well, we want to make sure that people are working. Are you serious right now? People are working. There's all these people who fall in the gap, the quote unquote working poor, right? Who make too much, you already heard the numbers, to qualify for the federal ACA. I mean, yeah, too much to qualify for the state Medicare program, but not enough to qualify for the ACA. These people fall in the gap. Florida is one of the top 4 in terms of uninsured in the country. These are abysmal numbers, y'all, and they are easily fixed. You talk to the healthcare community, you talk to people who need help, they know how to fix it, but there is no political will to do that. Not because Republicans don't, not because Democrats don't, and not because everybody else does, because regular people get it. It's the people in charge who do not care. For them, this is a political game. All of this is just, they're playing games with people, literally playing games with people's lives. And they do not care. And it took me a while to really accept that, you know, as an empath, as somebody who cares about people, who starts from a good place. Like most of the people in this room, like how could you just not care that people are gonna die? But then you hear stories like some of the ones you heard today. And I think of my aunt who gave birth on an emergency room floor because they wouldn't admit her until they cleared her insurance. And I think about these social media stories that we're seeing of women who are forced to give birth on their own, even though they're presenting a doctor because they're Black women, right? And that's gonna take us into how we got here. I'm gonna go back to some other bills in a second. But I need you to understand how this fits in the larger context so you understand what fight you're actually up against. Because there's track 1 and there's track 2. Track 1 is the traditional things that we do, the traditional organizing, the filing legislation, the talking to your representatives, the
getting ballot measures, right? Those are the above board things that we're doing. Those are the public facing things that we do to advocate for these things. But at the end of the day, power concedes nothing without a demand, and sometimes that demand needs to be a little bit more aggressive. Or you just find other ways to do it. So what are some other things that we can do as a community, knowing that these ACA healthcare credits are expiring, and you're gonna have people who are having their premiums triple and quadruple? I had one person, I sit on the healthcare facilities committee, and they walked through the numbers for us. And some people who are paying, let's say $400, are now gonna be looking at $1,500. Can you imagine? So we already know what that means. People are just not gonna have healthcare. We're gonna go back to where we were, right? They couldn't figure out a plan that was coming to replace Obamacare, so they just took it out altogether with the structures that they are in control of right now. So what do we do in a response? So in Florida, we're in a different place. We're legislatively read through gerrymandering and people moving here and all kinds of foolishness that's happening, right? But we, the people, all the people, regardless of political party, understand what's at stake. So we have to find ways to take care of ourselves while we're still pursuing these other paths. In South Florida, I put together a group of our local legislators, and we have these pilot programs going on. And what does that entail? It entails finding out all of your healthcare providers that provide free healthcare, and we're having these periodic health fairs because we know the deluge is going to be coming. So as the hospitals will start to close, as these things start to break down, we are making sure that people still have primary care, pediatric care, cancer screenings, their diabetes checks, their hypertensive checks, things that would normally be part of that preventive maintenance, which is a lot less expensive than the emergency care, right? So in the meantime, while this other stuff is going on, I don't need permission, I don't need a bill. I can just organize within my community. What can you bring to the table? Oh, you got breast care screening? Okay, we got you. You can do this, when can you do it? And you just organize it, rotate it periodically. We don't need permission for that. We can do that now.
Yeah.
And I think, thank you. And as we're rethinking how we approach the challenges that we face, I told you I wanted to kind of add some color, paint some brushstrokes into the problem that we're facing. The reality is we live in a country that is based on capitalism. And that capitalism has seeped into how we deliver healthcare and how we see healthcare. And if you really want to just do some Googling, you could do this later on, I don't have time to get in today, but look at the Carnegie Mellon Foundation and look at the Rockefeller Foundation and the reports that they made that completely changed how our medical system is from the medical schools on down. Because for this ruling class, and I choose my words with purpose, the average worker is just a tool to continue their exploitation of human and natural resources. This country was built on slave labor. And when I say slave labor, we're thinking about the Africans that were kidnapped here first, but it started with a genocide of the Native American folks that they tried to enslave, but they were dying off because of their diseases in droves and being killed off. So we need to be very eyes wide open about what we're dealing with, right? So some of those same people who are lurking in the background, who are the billionaires, who are the reason why we're taking away these entitlement programs in healthcare and food and all the things that normal people need to survive, right? They're able to take that away to preserve their tax rates when they're already billionaires and could never spend the money that they wanted to in 10,000 lifetimes. Because they're not focused on people as people. For them, they're focused on profits. right? So that's the larger system that we're fighting against, and this is a piece of that larger pie. So once you understand that, you just know that you have to move differently. There are times where you can partner with some of these people to do things, but know what you're up against. So as we know this, okay, so we have some cooperatives of ways to make sure we're delivering, we're continuing, and in states unlike Florida, where they have a majority, they can get some things done, it's easier, right? The lift is easier. Here we just have to be more creative, right? That's an example of some of the things that we're doing, and you heard about some of the work they're doing in terms of medical debt. So you heard about the Healthy Florida Act this year. So it has the comprehensive care, it has all of those things regardless of zip code, and we leave no community behind. What do I mean by that? You know who are on the chopping block right now. Right now in politics, they want you focused on the wrong 1%. The 1%'s the problem is the ruling class. They want you focused on trans folks, they want you focused on immigrants, they want you focused on all of that. Well, in this bill, we leave no community behind. So you have coverage regardless of your immigration status. You have coverage as an LGBTQ person who, if you want gender affirming care, you're still covered. All of the things that you need for all of your healthcare, for your whole self, are covered. And it pains me that I even have to stand up here and talk about this. But if you just imagine for me, I know we grew up in the United States, so we see things a particular way. But if you just think for a moment, everything you need as a human being, everything you need, food, water, the herbs that the medicine is made from, all of that is actually free, and it's in the earth. And if we are good stewards, it regenerates, and we always have more to take care. There should be nobody who's hungry. There should be nobody who is dying from a curable disease. This should not be a thing. Diabetes. And why don't I give Representative Harris a round of applause? Diabetes is such a huge thing, but putting this in the context that I'm talking about, the person who invented insulin gifted it to humanity for free. For free. You shouldn't be paying for insulin. But these drug manufacturers change one thing, the molecular structure, so that they can patent it, and they only make that one so that they continue their profits. Do you understand what I'm saying?
Yeah.
And the reason, you trying to say something?
Right.
Go ahead. All right, let's go this way.
No, this insulin thing just burns me so much, because as a nurse, I was, 50 years ago I was nursing. Insulin was a low-cost drug back then. Why is it so effing expensive now? Because of what she said, they can change its formula.
And to add that, to layer that, so different direction. The CEOs of like the top oil companies wrote a letter to the legislators asking them to rein them in, asking them to put some limits on them. Why? Because their incentive, their forced incentive is to make profits. Right? They have to answer to shareholders because that's how the system is currently set up. And they're like, hey, we want to do the right thing, and we see if we continue doing this, it's going to be bad for the earth, but we can't stop it because we have to respond to our shareholders. So we need your help. Did they get the help? No, because who bought those people off? We already know, right? But it's the same thing. And I'm just trying to help you connect the dots from a bigger level and a smaller level, right? Because we're all we've got. There is no Calvary coming. We are the Calvary. We are the resistance. And I know things are hard right now. Trust me, I do. I know it. I feel it. You feel it. But know that it's not a mistake that you're in this timeline, in this moment in history. If you're here, it's because you're here for a reason. What is your reason? Where do you jump into this fight? Where do you create your own fight? We're here together. We took time out on a weekend to be here for this conference. Give yourselves another round of applause. I so appreciate you because we are what makes the world go round. We are the ones that take care of each other. It takes people stepping up and doing whatever your part is to make it happen. Last thing is how we got here. So I talked a little bit about the ruling class, I talked a little about the basis of slavery. So healthcare and a lot of things in this country used to be free. But then the eugenics folks started popping up and like, well, you know, Black people, we can't let Black people have healthcare coverage. We need them to die off. So how do we attack Black people without attacking Black people? Well, we're the ruling class, so we don't care about poor people either. So let's just make it harder for poor people so we know we're okay. Because if they have an emergency visit or need to go see a specialist, right? They can just take their little private jet, go off and see whatever specialist they want in whatever country they want to, and they're good. They have zero understanding of what the repercussions of an emergency room visit are. Zero. So, when we're thinking about these issues, they're interconnected. From racism to sexism, how some things are reimbursed for women's care and other things are reimbursed for men's care, and they're similar things. And yes, we try to fight for parity, but you see it in the reimbursement rates. You see it in what steps people have to take. You see it in reproductive care legislation, right? So I'm just helping us connect the dots. But as you walk away today, I just want you to just think to yourself, what is it that I can do? You don't have to do the big thing all the time. Sometimes that's not your calling, but it could be a little thing, it could be a medium thing. But whatever your thing is, figure it out and get in the game, because we need you. And I love y'all.
Thank all of you. I wish we had moments for questions, but we are already over time and your lunch hour has been shortened by quite a bit. We are going to start the workshops 5 minutes later, but we are going to go ahead and let you go ahead and eat. But before we do, please, 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 let's give these people a wonderful applause. There are so many of us who thought we knew everything, and then we learned everything from you also. Thank you so much. The workshops start at, I haven't scanned this QR code yet. So
the workshop blocks start at 1:50, so that still gives you plenty of time to have a little lunch.
So 10 till 2, 1:50, okay, very good. And thank you so much.
Yeah, workshop leaders, if you could just come and check in with me really quick before you.
My bad. Workshop leaders, please check.
I'm gonna show you something.
Hey folks, I want to thank you so much for sticking around for our program today. We know it went over. I promise you tomorrow we're going to do a better job of staying on time, but I think it was worth it to hear all of those amazing speakers. And I really appreciate you all joining us, and I hope that you'll join us tomorrow. I think we got the tech down, and I think it's going to be a little bit smoother sailing. So thank you so much, and see you tomorrow.